Heartworm disease in dogs. Heartworm disease is a serious, even potentially deadly condition caused by parasitic worms living in the arteries of the lungs and in the right side of the heart of dogs that is spread only by mosquitoes. Today we are going to discuss what is heartworm, how do they get the disease, where is heartworm most prevalent, what are the clinical signs, how do you detect it, and how to prevent it. What is heartworm? Diarrhea mitis, known as heartworm, is a parasitic roundworm that is spread from host to host through the bites of mosquitoes. It infects mostly dogs as well as several other mammals, but we are going to talk about just dogs today. In dogs, adult heartworms can live 5 to 7 years in the heart and lungs. How do they get heartworm? Heartworm disease is spread by an infected mosquito. The infected mosquito bites the dog and then transfers the larvae to the dog's tissues. The larvae migrate through the tissues until they reach the arteries of the lungs and then the heart. This is where the larvae become adult worms and can grow up to 12 inches in length. They eventually cause severe damage to the heart and the lungs. Where is heartworm prevalent? The American Heartworm Society reports that heartworm disease has been diagnosed in all 50 states. Risk factors are impossible to predict due to multiple variables, climate variations, increasing number of wildlife carriers, etc. Because mosquitoes can come inside, both outdoor and indoor pets are at risk. Clinical signs of heartworm disease. Clinical signs of heartworm disease may not be seen in the early stages. As the number of heartworms in an animal tends to accumulate over a period of months or years and with repeated mosquito bites, the signs of heartworm disease becomes more obvious. Heavily infected dogs may eventually show signs of a mild persistent cough, especially after exercise, as well as fatigue, fainting, reduced appetite, and weight loss. As the disease progresses, there can be significant changes in the liver, which can lead to leakage of fluid into the abdominal cavity. This is known as cavul syndrome. Cavul syndrome is a progressed condition of heartworm disease. When the heartworm parasite has become too populous in the pulmonary artery of an infected dog, they can migrate into the vena cava, right atrium, and right ventricle of the heart. This is a life-threatening condition that causes issues ranging from jaundice and anemia, as well as liver dysfunction, heart failure, and death. How to prevent heartworm disease. Heartworm prevention is safe, easy, and typically inexpensive. There are several preventatives with different drugs that can be selected for your pet, which can also include flea prevention. Most heartworm preventatives also have monthly dewormer in them, keeping intestinal parasites at bay. Heartworm prevention comes in topical and/or oral chews, making it easy to administer. Prevention should start as early as possible with puppies. 8 weeks is generally a good time to start. How to detect if your dog has heartworm disease. Heartworm infection is detected with a simple blood test. The presence of heartworms cannot be detected until about 7 months after the initial infecting mosquito bite has occurred. Occasionally, heartworm infection can be detected through ultrasound and/or X-ray images of the heart and lungs, although these tests are usually done in animals already known to be infected. Dogs should be tested annually despite being on prevention.